Hi, Amanda. Thanks for
Hey,
joining
Danny.
for coffee.
Oh, absolute pleasure.
What are you drinking on your coffee break?
Soy latte.
Oh, nice, nice.
Yeah, delicious.
And tell me
What
honestly,
about
what you're wearing on the bottom half that I can't see.
really, really old track pants and runners? It's
Is that your daily outfit?
been my daily outfit since lockdown.
So
Comfortable.
for those of us that don't know who you are, tell me who you are, your work history, where you work.
So my name's Amanda. I'm a Div 1 nurse. I work at Bayside Medical Aesthetics in Brighton, and I've worked in dermatology for a long time, for close to 20 years, and started lasering about 20 years ago before it became a thing. Um, and really came to laser from wound management, which was an interesting jump. So I didn't go into it for the aesthetic reasons, but what red light and laser could do to heal wounds. And I fell in love with laser.
Fantastic. And you're also a per diem trainer for Cutera.
I am a per diem trainer for Cutera when they'll have me.
Do you like training for us?
I love training. There's that great saying, if you can teach it, you can do it. So I think it keeps me up to date and keeps me on my toes. And there's so much knowledge and information out there that it's great for me because it keeps me learning as well.
Yeah, we all have something to share. We can always learn something.
Always
So
one
what do
take.
you love most about this industry?
The most that I love is that you can get great change for people that are suffering particular conditions, rosacea being and sun damage being my area of great interest. And given that I have rosacea and that it can be in a good way life-changing if people aren't constantly red,
Oh,
having lived with that myself.
how wonderful. What does a typical day in your life look like at the moment?
Um, well, actually, a typical day for me at the moment is kind of nice because it's the first time in my life I've never had to go to work. So the first 2 weeks have been quite enjoyable because I've never got to spend so much time at home getting things organised. But I was getting a bit antsy yesterday because I'm starting to miss what I do. But that's okay. Everyone's in the same boat and we've all just got to do the right thing.
And so what's a typical day look like when you were in clinic?
Up early, dog walk, coffee, in clinic by 8, work till about 5 or 6, home and repeat. So busy, very busy days.
So what are you looking most forward to when the COVID-19 restrictions are lifted?
Oh, definitely being able to see my family actually, because I've got elderly parents and I can't visit them, and that's been really tough on them. And I've got a niece about to have a baby and I haven't been able to see her now for over a month. So, just things, yeah, simple things, seeing my extended family.
Looking
Will
forward
be
to
a big
getting back into
thing.
the clinic?
I'm looking forward to getting back into the clinic, yes, and my patients too. But for me at the moment, it's definitely I'm missing my family a lot.
Yeah. So I know you've used a lot of devices in your career. So in clinic, why did you choose the XLV? Why Cutera?
Um, well, obviously, I have used a lot of different devices, and the reason we picked the XLV was because for me it was just going to be a good workhorse, and so that meant that I could deal with um, a lot of it could offer a lot of different treatments for my client base. So definitely red, obviously, which I think it's brilliant at. Pigment, it's great to be able to do pigment, great to be able to do superficial leg vessels, and also then combining the maintenance of once I've cleaned up all that nonsense, the red and the brown, then Genesis comes into its own in terms of building collagenesis. So not only do you even out their tone, you can improve their texture. And also acne, it's great for people that cannot take or don't wish to take systemic treatments. And they're a small portion, but they are an important portion. So it kind of met the criteria of something that could treat a lot of different conditions and maintain being able to maintain people's skin in a good way.
So you said that you yourself suffer from rosacea. It's obviously Rosacea Awareness Month. How do you approach a treatment plan for rosacea?
So before we treat anybody with laser, we do a 1-hour consultation. So we go through everything in terms of rosacea. So what they're doing in terms of skincare. So we make sure they're on the right skincare. Also that it's a multifactorial condition. So it'll be very related to gut, and it can be very related to sun. So we make sure they're on an SPF. There are a lot of triggers for rosacea. Some people can, do something about that, and some people can't. And then we would treat them. How many treatments depends on the severity and the type of rosacea, and also inform them fully that it's maintenance, that it's not a one-off treatment and they're never going to get red again, that they have to do the maintenance. And I like annual maintenance. So once we've cleaned them up, that I'll see them back in 12 months' time. So once we get it under control, it's a great thing. And also informing, basically educating them that it's multifactorial, and that we can only deal with what we can deal with, and a lot they can do, which is good skincare and diligent use of SPF.
Do you have favourite settings on the XLV?
I do have very favourite settings on the XLV. I think if you've used a machine enough, and I do a lot of laser treatment, I have my go-to settings, and my go-to settings give me good, consistent results with minimal risk, and I'm risk adverse. So I don't want to give the patient a problem because I don't want to give me one.
How many times a week do you think you use the XLV?
In winter, I'd probably use it, well, I use it every day. How many times a week I would use it in winter, I'd be getting up there in numbers, probably 20 to 30 treatments.
Do you perform a lot of laser genesis?
I perform a little bit. We have a really good dermal clinician that does a lot of the genesis for us. I do the more a 532 hands-on settings. So, and then genesis to maintain. So we combine our genesis treatments a lot with peels and red light. So we're treating the epidermis and the dermis for collagen, for collagenesis, and we get good results with that. So I do a little bit of that, and I like doing it, but we also have a great dermal clinician that does that for us as well.
So for someone interested in getting into laser in their practice, why would the XLV be a product you would recommend?
Because you can treat so much with it. You can clean up their tone, which is the red and the brown in the skin. And once you clean up that their skin looks better, and then if you utilize the genesis setting, you're building collagen, so their skin looks better again. And yeah, it's the fact that we can treat red and brown, and it's a great, and you can do them together, so you can treat red and brown together. So it's a wonderful platform that can treat a lot in one go with good, consistent clinical results, because I think that's the key. If patients do, 2 or 3 treatments and they can see no difference, they're not going to come back. But if you can do 2 or 3 treatments and they can see great difference, they'll come back for their maintenance. We photograph everyone beforehand. We photograph before every treatment, and then we can show them 6 weeks after their last treatment the improvement they've had. Some people will need more treatments, obviously, and some people will need less. But I think photographing them pre and post is really important, because people forget what they look like. And it's really important to be able to show them the improvement in their skin. The same with genesis. It's very slow. You don't really start to see the collagenesis for 4 weeks. So if you can photograph them each time, by the time they've finished their course, they can actually see the difference in their skin.
Yeah, it's a beautiful, beautiful treatment. If you could invest in the next big aesthetic technology to complement your current practice, what would it be?
If I could invent it, I'd be brilliant. It'd be really nice to have, well, we've kind of got some of the technologies, but definitely tone and texture is what makes our skin look better. So the more even our tone, the more youthful we look. And if our texture is good, again, the better our skin looks, we feel better. So it'd be a technology that could deliver all of that without necessarily the downtime, which I think is probably impossible. But you never know.
Well, you mean enlightenment. That's what you mean.
That's exactly right. I can
Is
retire.
that your puppy in the background?
Say that again.
Is that your puppy in the background? Your dog?
Yeah. Do you want me to put my dog in another room?
Oh, I was just wondering.
Well, he's always by my side, and he's not liking the fact that I've locked him out.
Oh, you could have let him in. You could have sat with him.
Oh, well, hang on. Can I let him in? He won't bark. Hang on.
You don't have the dog with you.
He'll be quiet now that he's next to me. He's not used to being by my side. So when I'm at home anyway. So it would be nice if we could all take our dogs to work with us. It would be so lovely.
So what are you doing to engage with your patients during the COVID-19 lockdown?
Well, a lot of my patients have my mobile, so a few of them have texted me trying to work out when we'll be back, which we don't know currently, but we have a great practice manager and she's doing Instagram posts and we do email blasts just to let people know what's happening. And that's really not something that I have a lot of involvement in, but that's the way we're handling it as a practice, just keeping people informed and trying to touch base with them every week or so.
How have you been able to look after and encourage your co-workers, each other?
We have a really nice little text that we do, and we can still call because obviously our receptionist is still working. I talk to my boss every few days just about the situation and when we think we could possibly reopen, which of course is up in the air at the moment. So yeah, every few days we just have a little text to each other and make sure everyone's staying safe and feeling supported.
Yeah, that's nice. So who do you admire from this industry?
Oh, well, I admire Greg Goodman a lot, but then don't we all? And definitely Phil Becker, who I learned a lot of when I worked with him briefly at the Skin and Cancer Foundation. They have both taught me a huge amount, and from the States, actually, Stephen Eubanks has taught me a lot, Mitch Gold. So all those key opinion leaders are really important to listen to because they've got a wealth of knowledge and they're all really generous in their wanting to share their knowledge. And so I think we're very lucky. I think we're very lucky in Australia that we have great conferences and we've got people that are willing to share their knowledge.
Yeah, I agree. So what do clinicians or doctors do in our industry that really annoys you? But go easy.
Well, generally I like all of them, but I think not addressing skincare. I think skincare is so important, and it doesn't mean people have to spend a lot of money, but if they understand their skin type, epigenetics is changing a lot in skincare about the different skin types and how it reacts to skincare. Leslie Bauman has been a really good person or mentor that I follow. And so I think addressing good skincare is really important because lasers can do so much, but patients need to be able to maintain it. So I think understanding skincare, and it's not about being brand specific, it's about being able to deliver brands that people can afford, because not everyone can afford the top end. And just getting them on a good skincare regime. And I wish more doctors and nurses and clinicians spent more time just explaining what patients can do for themselves. And there are a lot of good topicals out there that are on script. So I work with the doctor that's pretty well across them, which is great. So it's good to use a combination. And I think a combination of laser and skincare and also prescribed topicals is, especially for rosacea, is great. Pigment, I wish people, a lot of people don't explain pigment well enough, that there is some pigment that cannot be treated with laser. And patients get very despondent when they have a lot of treatments and they get no result because it's probably melasma or chloasma, and that needs to be addressed very differently from pigment from sun or pigment that's genetic, such as macular ZKs and things like that. I just think it's, if you can unpack the information for a patient so they can understand it, you get better compliance.
How do you approach melasma or collagen?
I don't use laser for it, but except if it has it depends on their skin type, but all melasma or all pigment is inflammatory in some way. So if they've got a lot of inflammation in their skin and pigment, I would use a vascular laser to shut down the inflammatory component. But I don't use laser to treat the pigment. I would then take out the inflammation and use topicals. And there's a few dermatologists in Melbourne where I am that are experts. That's Michelle Rodriguez being the one that comes to mind, that are experts in melasma, and I will refer off to them to get them to manage it with topical treatments.
Right. So last question.
Yep.
Is there anything you'd like to say to your clients and all the industry right now?
Oh, well, I just wish everyone well. It's tough for everyone. Everyone's doing it tough. Most clinics that I know have closed. They've certainly closed their laser side and their aesthetic side, and that's tough on everybody, but everybody's doing it tough. And I think the best thing we can do is stay home, stay safe, and if we all do the right thing, this will be over quicker. And I think I have a lot of empathy for the people that are working in the hospital system who need as much support as we can give them.
No. Okay. Thanks for chatting with me. Thanks for having
me. Pleasure.
Let's do
anytime.
It soon.
Thanks, Danny.
Stay safe.
Bye.
Bye.